Did any of the patients speak English? How did you communicate with the patients? To collect history, for example.
The patients, they do not speak English, so you had to speak Russian. It was the only way. So that's why we had Russian classes. Actually, my Russian teacher, he was the only one who could speak Portuguese. But the classes were in English, so we learned Russian in English. But also my teacher, my Russian teacher, she spoke Brazilian Portuguese. Yeah.
Brazilian Portuguese.
Yeah, she spoke. Mm-hmm. And also I teach her. I taught her some phrasal verbs in Portuguese. Yeah, and in the final classes, she asked me to stay with her to do particular Russian classes because of my singing. So she kind of did a trainee with me. And also we had Latin classes. Latin classes. It's different here from Brazil. We don't have Latin classes in medical school.
Yes, we of course use some terms. That's when I also studied for the USMLE, even though I never took the actual test. But that's one of the things that surprised me about studying medicine in English. The fact that because Portuguese is a Latin language, we translate many of the Latin terms, whereas English, not being from the same family, takes the terms exactly as they are in Latin. So, with to some irony, I would say, we have the actual terms in Latin employed in English. So, I actually learned a lot of Latin studying English. I believe a non-medical example, an obvious example, for example, would be millennium, millennia, the plural that's made in Latin and is preserved in English. And we also carry this on to medical terms, such as, for example, one atrium, both atria, one bronchus, both bronchi. And it's quite interesting. So I believe perhaps Russian also has this habit of not translating Latin terms that could perhaps explain it.